Picture this. Elena, a lively 74-year-old woman with a lot of stories to tell from having a family and touring the world for decades, walks into her bathroom one cool morning. She doesn't expect anything more than her normal morning ritual, which includes cleaning her teeth, washing her face, and having a cup of tea. But all of a sudden, she feels dizzy and the room starts to spin. She doesn't have a stroke or heart attack, but her heart is hammering steadily, and something feels really wrong. It's her circulation that suddenly drops, making her weak and confused. And the unexpected culprit? It wasn't a rare sickness or genetic quirk. It was a behavior she'd had for more than 50 years that society typically thinks is innocuous or even healthy self pleasure. But I want to be clear, the problem isn't the act itself. It's the small ways she'd handled it for years, routines that seemed good when she was younger, but had turned into quiet risks as she became older.
Patterns that no one ever tried to warn her about. Hey everyone, I'm Dr. Leila, and for more than 30 years, I've worked hard to help women like you, those in their 60s, 70s, and even 80s, deal with the small changes that come with becoming older. We talk a lot about how to control cholesterol, blood pressure, and bone density, but we don't talk about the big changes in circulation and intimacy that happen as we get older. But these things affect everything: your confidence, your energy levels during the day, how well you sleep, and how close you are to the people you care about. Today, I want to talk about something that means a lot to me: the ways that some self pleasure habits could be bad for your vascular health that you might not have thought of. I'm not here to condemn or scare you. I just want to help you learn, feel strong, and get some kind advice. I've heard retired teachers, dedicated caregivers, creative people, and devoted grandmas reveal their innermost fears in quiet tones in my practice. They didn't know that four common mistakes people make while trying to learn about themselves, mistakes that seemed fine when they were younger, could cause problems that aren't obvious but are nonetheless important after 60. Why does this change happen? Our bodies change as we get older, and we need to be more mindful of these changes. Blood vessels naturally become less flexible. Hormones like estrogen that used to make us feel more aroused and help our bodies heal become less active, and our skin becomes thinner and more delicate. Things that used to bring you comfort and joy can now create small injuries, less responsiveness, and even circulation problems if you don't pay attention. So come with me as we look at these four frequent mistakes I make all the time, and more importantly, how to improve your approach for long-term health. Stay with me until the end, because the fourth one trips up over 90% of the great women I talk to, and fixing it might change your whole health.
If this resonates with you, please hit the like button, subscribe, and ring the bell for more personalized information about women's health in our golden years. And if you're listening, please leave a 1 in the comments if you agree, or a Z if you're still thinking about it. I really appreciate hearing from you. Let's talk about the first mistake, which seems useful and saves time, but can slowly damage your blood vessels each time you do it. The first mistake is to rush through the event, which can shock your circulation. I've had many deep talks with strong women over the years who have shared their private habits with me, often with a hint of shame or confusion. Dr. Leila, they would add softly, I just wanted a quick release so I could relax or fall asleep. I understand that life's pressures don't go away with age and that wanting to be efficient is normal. But after menopause, going too fast can have bad effects. When you speed up self pleasure, your body reacts as if it is under unexpected stress. Heart rate suddenly goes up, blood vessels in the pelvis constrict tightly before quickly expanding, putting pressure on the tiny capillaries in sensitive locations like the clitoris and vaginal walls. These areas are now more fragile because of hormonal changes and time. When we were young, our circulatory system could easily tolerate these surges, like a rubber band that snaps back. But around age 60, arteries become less flexible and estrogen's protective effects wear off, making tissues more likely to rupture and take longer to heal. It's not about morals or what's right and bad, it's just biology. Consistent rushing may not have an immediate effect, but over time it dulls sensitivity, delays excitement, or causes temporary numbness where there used to be strong sensation. It also teaches your nervous system to see pleasure as a chore rather than a calming routine. This can affect your whole life by making you less trusting of your body, changing how you interact with loved ones, or even messing with your sleep habits. I typically tell my patients to think of self pleasure like enjoying a good meal. If you eat it too quickly, you won't taste the taste and your stomach will hurt. But if you take your time, it really feeds you. I've seen ladies get that warmth back in my clinic by making those moments last longer, like by doing light massage or deep breathing. Sarah, a 68-year-old widow, came to me because she was upset that her responsiveness was disappearing. After we talked about pacing, she told me that slowing down not only brought back her bodily sensations, but it also made her feel better and gave her more energy the next day. Studies published in the Journal of Sexual Medicine back this up by indicating that postmenopausal women who are aroused slowly and mindfully have better blood flow and less stress on their blood vessels. It's important to respect your body's new rhythm and make intimacy a source of refreshment instead of stress. Even if you want to slow down, you could fall into a second trap without realizing it. This trap is intuitive but has a huge effect on your nervous system and flow. Let's find out what that is now. Mistake 2: holding your breath and pelvic muscles tight, which can cut off important blood flow. Over the years, I've seen a small tendency among many of my patients. It doesn't show up in test results or routine checkups, but it does show up in their experiences and physical signs. Women over 60 typically tense their core without realizing it while they are having fun with themselves. Their shoulders hunch, their bellies contract, and their breathing becomes shallow or stops altogether. It may appear small, yet it has big repercussions. When you clench your fists, your body goes into survival mode and releases low level tension. Blood arteries get smaller, stopping the flow of oxygen rich blood that the clitoris and nearby tissues need to swell up and make those pleasure nerves fire. Why is this so important? The clitoris has more than 8,000 nerve endings, which is more than any other part of the body. It needs regular circulation to stay healthy, just like a flower needs water to flourish. When you're tense, you're sending out a message of danger instead of peace, which can make your muscles weaker, your lubrication worse, and your body start to link intimacy with fear instead of happiness. Over time, this might completely take away the fun. I remember a beautiful moment with a 72-year-old artist named Maria who told me she felt disconnected down there. When I asked her about her breathing in a calm way, her eyes got big. She didn't know she was keeping it in, which was something she had done for years as a teacher under a lot of stress. We did basic things like breathing deeply through the nose, gently exhaling and relaxing the hips and jaw. In just a few weeks, she said that she was not just more sensitive, but also more relaxed in general, even in her daily life. The American Journal of Obstetrics and Gynecology found that deep diaphragmatic breathing can increase pelvic blood flow and lessen menopausal symptoms, which is consistent with this. Your body, especially now, wants to work with others, not be in charge. Relax and let your breath be the bridge to greater circulation and deeper happiness.
But if you get breathing and relaxation down, another well meaning tendency can get in the way of your progress. This one comes from habit and good intentions, but it doesn't take into account how your requirements are changing. Mistake 3: doing something every day without giving yourself time to recover, which will slowly drain your natural energy. For many women who are retired, have lost a partner, or are alone, self pleasure becomes a daily comfort, a way to relieve stress, take a break, or fill in for missing companionship. That regularity might have made you feel better in the past, like a vigorous stroll every day. But after age 60, getting better is the most important thing. Tissues heal more slowly, hormones change, and what was refreshing becomes tiring without breaks.
Think of it like gardening. Young plants bounce back fast after being cut, but older ones require time to grow. If you keep stimulating yourself, you might not respond as strongly, feel sore all the time, or feel empty inside. You can have trouble getting aroused spontaneously or feel strangely disconnected.
Brenda, a 65-year-old nurse I helped, started doing her daily tasks again after her husband died in the hopes of finding comfort, but she ended up feeling more alone. She cried, "Dr. Leila, it's like the spark is gone." We tried spacing sessions every other day and adding things like sensual showers or light reading to keep things interesting. Her energy came back quickly, and research from the archives of sexual behavior backs up the idea that intermittent practices help older persons keep their dopamine sensitivity and vascular health. It's not about denying your feelings, it's about finding a balance that lets desire grow naturally and makes each meeting feel good. Even with careful spacing, the most common problem I see comes from the mind, not the body, and it gets into your deepest feelings. Mistake 4, relying on hyper intense imaginations that overload the mind and make real connections weaker. This one is sensitive since it talks about being alone, wanting to be near to someone, and the search for connection. A lot of the women I care for use complex daydreams, hot books, or vivid web content to get themselves excited. Things that seem empowered at first. But when media gets more severe, the brain changes in ways that are hard to understand. Repeated exposure makes dopamine pathways less sensitive, which makes touch feel less exciting. Real intimacy fades not because of a defect, but because of conditioning. This change in the mind also affects the body. Arousal impulses from the brain slow down, which lowers blood flow, lubrication, and pleasure in the pelvis. It's even harder for older bodies with weaker blood vessels and fewer hormone levels. I've been there for ladies like Joan, 78, who cried, "I feel nothing with my new partner. Am I broken?" No, it was merely rewired. We worked on getting used to less stimulus by focusing on basic sensory things like soft textiles, beloved smells, and real memories. Neuropsychopharmacology studies show that neuroplasticity can reverse damage and restore natural pathways. Take a step back and remember the little things. Your brain will recover, and you'll feel real pleasure again. As Dr. Leila, a healer who has helped people through their weaknesses, I can promise you that if these indicators are accurate, you are not beyond repair. You can modify these behaviors and your body is strong. Start by slowing down, breathe, and relax to make moments holy. Let recovery breaks happen so you can recharge. Use subtle stimuli to retrain your mind. Have compassion for the you of today.
I've seen 75-year-olds find joy again through patience, not potions. Ask yourself, what's my first step today? Please share what moved you below. Your remarks are inspiring. You deserve pleasure that is bright and soothing. Be gentle.